Talking to your loved one after a stroke or traumatic brain injury becomes difficult if they have aphasia. Whichever type of aphasia they may have, there are many ways that you can lead them towards recovery. During the first few months of aphasia symptoms, it can be difficult to care for a person with aphasia. But keeping these simple tips will help you get into the right mindset, even in the long run, along with speech-language therapy. Tips for helping a loved one with aphasia. Here are some ways you help with your loved one's speech and language abilities. Give time to respond. When you talk to your loved one, give them plenty of time to respond. It will help them communicate as you are giving the person time to process what they heard and reply. Anytime they begin talking, don't interrupt them or finish their sentences. Instead of completing their sentences, watch their facial expression and body language instead. You will gain more context to what they are trying to say. Speak plainly and simply. Use short sentences and phrases to communicate. Simpler sentence structures are faster and easier to comprehend. It also helps to emphasize on key words. Aphasia doesn't affect their intelligence, so don't talk down to them. Keeping your language clear and simple is enough for good communication. Avoid quick questions and topic changes. Since it takes a bit of time for them to process topics, don't pile on different ones all at once. They will become overwhelmed and grow frustrated, and won't be able to respond to all of them if you don't give them enough time. Frequently use yes or no questions. Whenever you think of a question to ask, see if you can change it up to a yes or no question. These kinds of questions are easier to understand and respond to. Make sure to only ask about one thought or topic at a time. There are some questions where yes or no may not be enough. You can still use open-ended questions, but use close-ended ones more often. Avoid correcting them. Communicating clearly and effectively will be a long process. Errors will occur when they speak from time to time, but it's important to avoid correcting them. Practice positive feedback and praise, especially when they attempt to speak. Engage in normal speech activities. Normal conversations will help them learn and practice the words that work often. Remember to speak to them clearly and concisely, but with the same tone you would use with a normal person. It's important to acknowledge them as they are, and you are not talking down to them like a child. People with aphasia often know what they want to say, they just don't have the right means to do so. Keep distractions to a minimum. Before you talk with your loved one, think of ways to prepare your environment for communication. This can include reducing background noise and keeping away visual distractions. The lack of distraction will help the both of you pay attention to each other's facial expressions and gestures. Communicate to understand. Feedback is fundamental to knowing how to communicate better. If you're unsure of what your loved one is communicating, you can nicely tell them so. A simple, "I'm sorry, I don't get what you're saying yet. How about we try again?" can go a long way. As said earlier, you can also confirm by using yes or no questions instead of assuming what they were saying. Use other means of communication. Don't be afraid to use tools, materials, and other nonverbal cues to help support their communication skills. They may be hesitant to use augmentative and alternative communication, or AAC, since it's not normally used by other people. However, using such communication aids, apps, and tools would fill in the gaps of your loved one's current communication abilities, which is more important. You can use gestures and facial expressions, drawings and visual aids, AAC or augmentative and alternative communication apps, and speech-generating devices. Always have the tools available to your loved one, whether it be paper and pens or a speech aid device. You can also collaborate with them to create a set of visual aids like cards and pictures to help when you are talking to each other. Aphasia can be a difficult journey for you and your loved one to navigate, but it's not impossible. You can get more instructions for your loved one with aphasia through your speech-language pathologist. Book your free consultation today with Aphasia Speech if you're interested to learn how speech-language therapy can help.